Hi, my name is Dr. David Dane, and I've had the pleasure to be the co-lead of the clinical working group for the Connecting Ontario Greater Toronto solution for about 6 years now, and it has been a tremendous experience for me. We've tried to build a solution that really is built with clinician feedback throughout the entire cycle, and it's been very rewarding as a participant and as a lead in the program to see the clinical involvement that has been present right from the beginning days where this was just an idea through to a process of gathering what would be the requirements for our system, through to procuring the system, designing, building, and finally, as of a few years ago, putting the system into production. Seeing all that clinical input being represented in the solution has been very rewarding for me.
Hi, my name is Edward Etchells. I'm a staff physician in the Division of General Internal Medicine at Sunnybrook Health Sciences Centre. I think Connecting Ontario has changed patient care for the better. I was recently assessing a patient in the Sunnybrook emergency room who had pneumonia and severe anemia. Connecting Ontario was able to tell me that the severe anemia was chronic, unchanged, fully worked up, and under the supervision of a community hematologist. This information allowed me to discharge the patient from the emergency room with confidence and appropriate short-term follow-up.
Oftentimes we don't have a lot of information yet on our own SunnyCare system, so I've gone to Connect Ontario to get the medical information that I can provide the physicians in the community in order for them to provide home visits. I've also used it to determine what kind of CCAC caseload they're on to ensure that they're on a palliative caseload and thereby getting the best possible support.
I use Connecting Ontario on a daily basis. It helps me with patient care. I'm able to look at different hospitals and get patients' lab values or radiology reports, their background, their history. For example, yesterday I used it to look up a patient's history that was unresponsive. We were unable to get their information, but using Connecting Ontario, easily we got their background history and their medications. With that information, we were able to find out that their presenting illness was based off medication overdose that they took.
I use Connecting Ontario to help facilitate locating information on patients. It is quick, it's easy, it's efficient, and it helps me to not have to call and bother doctors' offices and patients for information that I can quickly get off of their system.
I use Connecting Ontario on a day-to-day basis in my clinical practice. I find that a number of my patients have other health issues that they may not receive care at Sunnybrook for. So if I want to get more information about a patient's, say, cancer treatment or any sort of other issues that they may be receiving care at another hospital within the Toronto area, I can easily use Connecting Ontario to just pull those notes.
Connecting Ontario allows me to review the different tests and investigations that my patients have had at other centers. For some patients, they've seen many different specialists and had a number of different investigations, and this way I can review that sometimes in advance and see what's been done so far in their medical care.
I'm working on a program that involves medically complex patients. I'm actually a community nurse, and I was brought in for this program, which is Telemedicine Impact Plus. So my program is looking at ways that we can look at medically complex patients who go to many, many different doctors over time and often have different referrals at different hospitals with different specialists. And Connecting Ontario allows me to go into their files quickly and actually develop a profile of the patient that is based on their past tests and also specialist consultations.
In summary, I think Connecting Ontario has changed patient care dramatically for the better in Ontario. It improves access to clinical information in a timely fashion. It allows clinicians to make safe, effective, and efficient clinical decisions, and it improves the consultation process so the patients have a much better experience because of continuity of information. Thank you.